Hi, I'm Dr. Anam Dharani, and I am currently a family medicine resident physician at Houston Methodist Hospital. I earned my bachelor's degree in biology at University of Texas at San Antonio, and then went on to pursue my medical degree from University of the Incarnate School of Osteopathic Medicine. I have had many years of mentoring and tutoring, and my journey began when I started mentoring English second language learners from Afghanistan, and they were refugees, and really seeing their progress and trajectory was so rewarding. So I went on to continue to do that in the capacity I know best, which is related to medicine, and began mentoring undergraduate medical students and medical students applying to residency. Currently, my specialty is family medicine, and my interest is in geriatrics, especially the underserved geriatric population, which at times can also be very neglected. I have special interest in really working on the polypharmacy aspect side, as well as chronic disease management. I'm also interested in really serving this elderly population in skilled nursing facilities, really being able to help with transitions of care and goals of care discussions. And of course, as family medicine, patient education is where we thrive the most. So making sure patients are well informed, well educated, and able to really advocate for themselves. I rotate through many different inpatient services, so to be able to be well-rounded. And also I am at a continuity clinic, which is a federally qualified health center. So I received the Patient Institute Physician in Training Award for patient-centered care during my rotations at medical school. I also went on to serve as the social chair for our Student Government Association at the Incarnate School of Osteopathic Medicine. I'm super bubbly and super social by nature, so this was definitely my calling. I helped plan lots of social events and then went on to do something similar. Currently, I am the wellness chair for our residency program, which of course entails planning lots of fun activities, making sure that our residents are really practicing wellness. I believe the key to success in medical school is really learning to be adaptable and being able to adjust to different scenarios and situations, as you'll be rotating through so many different specialties and services. I also feel like it's super important to learn how you love to learn and what works best for you and what strategies work best for you. And in all of that, in terms of your personal passion, really recognizing and understanding your why, understanding what is your drive and your biggest motivation to continue on with this journey, and having that as a constant reminder, because things will be a little bit more stressful at times as you're navigating through different rotations and preparing for boards and exams, but really making sure that you continue on in this path and this journey. Of course, knowing how long and how much time and effort it took you to get there. So really practicing that, as well as practicing self-care, pouring into yourself as much as you do your academics. Over the many years of mentoring, I feel like what sets me apart is really understanding that it's never one size fits all. I really like to make sure that I learn my students that I'm mentoring and learning what's best for them and approaching scenarios tailored to that and really individualizing the process. I am, again, super personable, and I really want to make sure that my students feel comfortable during the process, making sure that we put their strengths forward and really building the application around what aligns with their goals best. Also, while doing all of that, I want to make sure that we're thinking long-term and thinking about big picture, making sure we're focusing on our small wins as well as our end goal. My greatest strengths as a mentor and coach, I believe, are that I'm very personable and very approachable, easy to talk to. I am very quick to build rapport with my students and really creating a supportive environment from the get-go. I know the process can be super overwhelming, at times stressful or confusing, and really being there to be your biggest cheerleader, your biggest motivator. At the same time, I want to make sure that we have a collaborative space, so being able to provide that constructive feedback and giving actionable steps I think is super important. And I am very organized by nature, so I really like to break down bigger tasks into small wins and tasks and goals that we work towards, and making it a lot more manageable for students. And then of course doing this over many years, serving as an interviewer at medical school, as well as now serving as part of the admissions committee for the residency program. I really know what these committees and program directors and faculty are looking for in their students and residents that they are interviewing, so really understanding that process and being able to highlight exactly those strengths and bring those strengths forward of applicants. So really being able to showcase that is something that I'm good at. I'm a very active listener, so I want to make sure that we are addressing everything. And overall, I just want my students to feel very empowered and confident during this process. So doing everything possible and pouring energy and time into a very fruitful outcome. When I received the right support and guidance and mentorship during the process, I remember it became such a smooth process and so much more relaxed. I had them at my disposal to be able to ask questions, and now having done this for several years, it's such a rewarding process, going from end to end, starting from scratch, and really developing something really unique for every one of my students. And I really love putting them in their best light, building that confidence within them, and really helping them believe in their strengths. I really want to be able to part of that journey, and I hope that we can be in this journey together and really take the next step in the journey of medicine.